Hi, I'm Sandra Barrington, Executive Director of Sierra Nevada Memorial Hospital Foundation, and welcome to Doc Talks. This is a series where we bring local physicians to you to learn more about our healthcare community and maybe a little bit about what the future of medicine might be right here in Western Nevada County. And I have an extra special guest with you today because this is my family primary care physician that I've been with for probably about 15 or 16 years. So very excited to have Dr. Jill Fitzpatric with us today.
Thanks, Sandra. It's glad to be here.
Yeah, and as I mentioned, she is a primary care physician. So why don't you tell us a little bit about your educational background and what it takes to become a primary care physician?
Sure. Yeah, I'd be happy to. We're always trying to encourage more people to go into primary care, so whatever information I can give you is great. So for me personally, I actually grew up in Canada, and so my education is a little bit different than some from here. I went to medical school in Toronto at the University of Toronto and did my undergraduate training there, and then went to medical school there in Toronto as well. And then from there went on to complete my family medicine training at McMaster University in Hamilton, Canada. So finished that and then came to the United States, and I've been practicing here since for quite a long time. Yeah. Maybe I won't say the date.
Yeah, we
and did my boards here as well as soon as I came here. And yeah, so that's been basically my training. In family medicine, we do a recertification every 7 to 10 years.
Okay.
Through the American Board of Family Medicine, so we've been completing that too.
And what was it about family medicine? There's so many specialties you can choose in medicine, variety of different things. What was it about family medicine that drew you in that direction?
That's a really great question, because when I first went to medical school, I actually thought that I wanted to be a surgeon. And as I went through my training and got more experience in all the different parts of the healthcare, and I was way more interested in more of a holistic approach to the patient and all of the various components, and that's when I changed my mind and decided to wanted to go into primary care so that I could actually be a part of a person's journey throughout their life and all the various things that are going on and the things that we can do to help prevent them from having diseases and conditions that land them in the specialist office to begin with.
That's great. And now you're also the medical director of Dignity Health Medical Group. So not only are you a practicing physician, but also you're in administration now.
Right.
And how is that different?
So it is quite a bit different, but it really allows me to see what's going on from both sides. And I really see that my role is multifaceted. One, I can act sort of a liaison between the physicians and administration, sometimes as an interpreter, because the two sides look at things very differently, and our healthcare system is very complex. And we want our physicians to be able to just focus on practicing medicine, and so having someone advocate for their position and their needs is actually really important. So I see myself doing that, but I also see that there's an importance for physicians to learn more about how healthcare works, so that we can be responsible and make sure that we are, of course, advocating for our profession, but also for what needs to happen for the future.
Well, thank you for that. I know it's a big job. Yeah. So within family medicine, what would you say is maybe some of the most common reasons people come to see you, or some of the services that you offer within your office?
So as you know, we see, and especially in family medicine, we see people from birth to 99, 100. We have some patients that are over 100, especially in this community. We have a very high proportion of healthy seniors. So we focus a lot on preventative care, and I think that's the one thing that we really want to promote, because the more that we can help people stay healthy and enjoy a good quality life is really important in primary care. Of course, we help to manage a lot of chronic conditions as well, and helping to keep people stable with medications or even health lifestyle modifications for their chronic conditions. As well as acute visits too that come up. But really the whole gamut of things we see in primary care. But I see that one of the real cornerstones is the prevention.
Yeah, that's so important. It helps the entire system of care, if we can keep people living healthy, they're not in the emergency department, they're out active in the community. So preventative medicine is such an important part of the whole system.
Yes, exactly.
So we're in a rural community. We all know it's hard to recruit physicians here, but what made you choose to come live here?
So when I first came to California and I was practicing, I was actually living in San Francisco, which is a wonderful place to live and to work for a period of time. But what Nevada County has to offer is a really great place to raise a family, enjoy the outdoors. And so when it came time to wanting to raise a family, that's when the choice was made to move here, be closer to the mountains, and be able to raise my children in a place that was safe and they could be outside and have good schools, and I could still have a really great community to practice medicine. And in being in a small community is really a nice place to be practicing, because we can see our patients, we can understand where they live, where they work, and how then we can help them with their health care and service what is important to them. So
Yeah,
that was really
that's so
important
great.
to me.
Yeah, and you do have sweet kids. You've done a good job.
Yes.
Yeah.
They're not so kids anymore.
Well, yeah, they're out of the house.
Yes.
They're college bound and all of those things.
Yes, exactly.
Yeah. Yeah. So what do you do when you're not working? What kind of hobbies do you like to do outside of work?
I like to get outside and enjoy where we live, so a lot of hiking and skiing and getting out into Tahoe and
It's right in our backyard. It's amazing.
yeah, doing a little bit of traveling here and there, and trying to take advantage of all the time that I have when I'm not in the office, so that I can practice what I preach.
Balance,
Try
right?
to, yes,
Yeah.
balance.
Yes, it's good for our mental health.
For
So
sure.
what do you see as, in your specialty of family medicine, the future of that in our community here?
Well, we're still continuing to grow primary care, which we realize in healthcare, like I mentioned earlier, is a real cornerstone of trying to keep our patients and our communities healthy, whether it be with preventative screening tests or vaccinations or lifestyle modifications. So we see that primary care is really important for us to build and continue to build in Nevada County. So we're focusing a lot of our recruiting efforts there. We are continuing to look for both APPs, so that would be nurse practitioners and physician assistants in primary care, as well as internal medicine and family medicine physicians. We're doing a lot of outreach to residency programs. We've had some success with doing some residency program retreats. And we have a new physician in our group that we were able to recruit from one of those events. So we're really looking to continue to do that, promote the beauty of the community. We've seen a lot of the success at recruiting physicians here be because they choose the community, and then the work position fits their needs as well. So we want them to love Nevada County, which isn't too hard once they get here.
Yeah, and I've heard a lot around advanced practice providers. Sometimes they're referred to as mid-level providers. Can you
That's
give a
right.
little bit of insight into what exactly can they do, can't they do? Because I do see that as being the future of having to fill those healthcare workforce gaps and getting people into those roles where they can still support the community.
That's a really great question, because we do see that people get confused. And so our APPs, or advanced practice practitioners, can be, in our practice, that would be nurse practitioners, family nurse practitioners, physician assistants, certified midwives would also fall into that category.
Okay.
And what the APPs actually are very autonomous. They work in collaboration with the physicians, and they actually can do a lot of the care. And then we always have a supervising physician that is available for extra questions or to see the patient in collaboration when necessary. So.
Great. So would you encourage people, if there is an option to have an APP, to go see that and make a relationship with that person?
Yes, absolutely. And particularly if it's within your own primary care office, knowing that they are working in collaboration with your physician So.
Yeah, well, great. Well, thank you so much for joining us today. Thank you to Dr. Jill Fitzpatric, a local family practice physician. And this is Doc Talks. You can find us on Nevada County Media or at supportsierranevada.org. Thank you so much and look forward to seeing you again.